Good day, everyone. Welcome to our lecture on outlet forceps extraction. This is a type of assisted vaginal delivery which employs the use of forceps. These forceps are designed to aid in the delivery of the fetus by applying traction to the fetal head.
What are the indications and contraindications of forceps delivery?
Termination of second stage labor by outlet forceps extraction is considered for any condition that threatens both the mother and the baby. Fetal indications include non-reassuring fetal status and correction of suboptimal attitude or position of the fetal head. On the other hand, maternal indications include pre-existing or intrapartum conditions that limit effective pushing or warrant expedited delivery, as well as medical indications to avoid Valsalva such as cerebral vascular diseases and cardiac conditions. It is also indicated when there is inadequate progress of labor and lack of effective maternal expulsive effort. Apart from this, assisted vaginal delivery may also be employed to assist at cesarean deliveries if required and to assist with the aftercoming head of breech deliveries. Contraindications to forceps delivery include fetal malpresentation, fetal disorders such as bleeding disorders and demineralization disorders, or any contraindications to vaginal delivery.
What are the prerequisites for forceps delivery?
To aid in patient selection, prerequisites for forceps delivery include an informed consent from the patient, appropriate anesthesia, an empty bladder, adequate uterine contractions, and lastly, an engaged vertex with a fully dilated cervix and ruptured membranes. The exact position of the fetal head must be determined, and forceps delivery must be done by an experienced operator with adequate facilities and available resources. The operator must be knowledgeable of the instruments and their use, as well as the possible complications that can arise from the procedure. In addition, there must be a reasonable chance of success and absence of evidence of cephalopelvic disproportion. There must also be a backup plan if the procedure is unsuccessful. Apart from this, the facility must be equipped for ongoing fetal and maternal assessment. It is also important to have an appropriately skilled personnel for neonatal resuscitation.
What are the materials used for forceps delivery?
Materials for the procedure include forceps, sterile gloves, towel, sutures, bandage scissors, cord clamp, Kelly clamp, umbilical cord scissors, thumb forceps, and a needle holder.
What are the neonatal and maternal risks for forceps delivery?
Maternal complications include maternal soft tissue injury and obstetrical anal sphincter injuries. On the other hand, neonatal morbidities include facial lacerations, hematoma, intracranial hemorrhage, nerve palsies, and skull fractures. To facilitate successful delivery and to minimize feto-maternal trauma, the following steps must be carefully followed. First, we make sure that the forceps is fully functional by doing phantom application. Two or more fingers of the right hand are introduced inside the left posterior portion of the vulva and advance into the vagina beside the fetal head. The handle of the left branch is grasped between the thumb and two fingers of the left hand. The blade tip is then gently introduced along the posterior left vaginal wall. It is swept upward and inward between the fetal head and the palmar surface of the fingers. For application of the right blade, two or more fingers of the left hand are introduced into the right posterior portion of the vagina to serve as a guide for the right blade. The blade is held in the right hand and introduced into the vagina. With each blade, the thumb is positioned behind the heel, and most of the insertion force comes from the thumb. Gentle, intermittent downward and outward traction is exerted concurrent with maternal efforts until the perineum begins to bulge. During this time, an episiotomy may be considered. The forceps is removed once the jaw is reachable or delivery is assured.